So today I'm going to present a case that most of you guys have probably experienced at some point in your life, acute back pain. Now, about 8 out of 10 people at some point in their life will experience back pain. It's the leading cause of disability worldwide, and it's the second most common reason why people visit their doctor. All right, here's the case. Sudden pain to the ground. So that was a 42-year-old female who presents with acute back pain. She was walking down the stairs and felt a knife in her lower back that brought her to her knees. Now, earlier in the day, she was moving furniture and lifted something pretty heavy and felt a little twinge in the back at that time. This is me. This has happened to me 3 times in my life where all of a sudden you feel sudden pain and it's debilitating. It's like incapacitating pain. It may have happened to many of you at some point in your life too. Now, what do we do about it? I mentioned how common it was. So if you experience acute lower back pain, what do? Should you rush to the doctor and get an MRI? Should you wait it out? So my questions for this case are, what is the most common reasons for acute lower back pain? What are home remedies or things that you should do at home if you experience this type of pain? When should you go to your doctor or even go to the emergency department if you have acute back pain? And what are the criteria for imaging acute lower back pain, meaning X-ray or MRI? And last but not least is, what are prevention strategies that you can do to help prevent acute low back pain? As always, stay tuned for tomorrow's follow-up video, and I will go through all the answers to this most common problem for you. So here are the answers to the case study I presented yesterday. We had a 42-year-old female who presented with acute back pain. She was just walking down the stairs and felt all of a sudden a knife-like pain into her lower back that was debilitating. She had been lifting furniture earlier in the day and felt a little tweak in the back. So my question is what are causes of acute lower back pain? This is really important because acute low back pain is one of the most common reasons why people visit their doctor. Back pain itself is one of the most common reasons for disability worldwide. Now, the most common reason for acute back pain is some type of musculoskeletal or ligamentous injury, but it could also be from some type of disc injury. In the majority of patients, this is a self-limiting phenomenon, meaning it will resolve on its own. We usually treat it acutely with anti-inflammatory medications such as over-the-counter ibuprofen, as well as other prescription medications like muscle relaxers or steroid medications. The potential serious concern about acute lower back pain is what we call cauda equina syndrome, and that's where a patient may present with numbness in their perineal region or in their groin and private parts region with any kind of concerns of bowel or bladder incontinence, meaning they go to the bathroom and then don't know. That could potentially represent a medical and surgical emergency. In the absence of those critical red flag symptoms, we usually recommend conservative treatment for a minimum of 6 weeks. What do you mean by conservative treatment? It really boils down to just activity modifications and taking it easy, and that can include things like physical therapy, acupuncture, alternating heat and ice, and even chiropractic manipulation. Imaging of the lower back, such as MRI, is really reserved for patients that have symptoms beyond the 6 weeks because honestly, the majority of these cases are self-limited. I would argue that prevention is probably the most important thing to prevent lower back pain. This would include smoking cessation or not using nicotine products, which we know can accelerate degenerative disc disease. This also includes weight loss strategies for patients that are obese. Now, one of the most important prevention strategies, in my opinion, is the maintenance of core strength. Your spine really relies on its structural support system for its health. And if you don't have a strong core to help support your spine, you really rely on your discs and your bones a lot, and they will degenerate over time. Proper lifting techniques is really, really important in preventing acute back pain. The majority of injuries that I see in my practice are usually preventable. So to summarize, acute low back pain is extremely common, but the good news is that it usually is self-limiting. If you have symptoms despite conservative treatment, you really should see your doctor to have it appropriately worked up and managed. So not a very exciting case study this week, but a very common one nonetheless.